Hi, everyone. I'm Deshawn Dorsey with AVIMED, and I'm honored to join you this afternoon to present the 2020 Alliance for Aging Research Silver Innovator Award to Dr. Derrick DeWitt, Chief Finance Officer and Director of the Maryland Baptist Aged Home. The Silver Innovator Award is given each year to an individual who shows exceptional dedication to anticipating, embracing, and addressing the unique and ever-evolving needs of older adults. This year's award honors Dr. DeWitt for his tireless work on behalf of older adults. You may have heard of the Maryland Baptist Aged Home. Not only is it the oldest African-American owned and operated nursing home in the state of Maryland, it has also received national praise for having 0 COVID-19 diagnoses. Considering the national infection rates, especially among older adults in long-term care settings, and even more so among older adults of color, this is a feat that must be recognized and celebrated. Dr. DeWitt has long served as a model for people-centered, compassionate, and evidence-based long-term care. His extraordinary compassion and care for others extends far past his work as Director and CFO of Maryland Baptist Aged Home. His humanitarian efforts greatly impact his hometown of Baltimore City and extend abroad to Africa, where he and his wife support orphanages in Kenya and Uganda. His church operates model food programs, a weekly soup kitchen, free summer camps for youth, a weekly addiction ministry, affordable housing, and much more. Dr. DeWitt, thanks to you and the staff at the Maryland Baptist Aged Home for keeping your residents safe and well and serving as such a remarkable example. It's wonderful to be with you today and to present you with the Alliance's Silver Innovator Award. Congratulations.
Thank you, Deshawn. Thank you so much for that kind introduction, and thank you for speaking with me today. And I just want to say hello to the Alliance for Aging Research and to the guests who have come together to celebrate the important work that you do on the behalf of the nation's older adults and all Americans. And to the President and CEO, Ms. Sue Pension, to the staff and the Board of Directors, thank you for honoring and choosing me for the Silver Innovator Award. I'm humbled by this award. Thank you.
Thank you again, Dr. DeWitt. And Dr. DeWitt, I would just like to ask you a few questions regarding the work you're being recognized for. So let's get started. More than 40% of COVID-19 deaths have occurred in nursing homes. But as Director and CFO of the Maryland Baptist Aged Home in Baltimore, you and your colleagues played a key role in preventing COVID-19 from entering the facility. And there have been 0 cases of COVID-19 at the Maryland Baptist Aged Home. What actions were taken to make this possible?
Well, certainly a lot, and all of the credit has to go to our tremendous staff and our medical team. But the main things we did, we acted early and we acted aggressively. And when I say early, our facility was shut down to visitors by about February 28th. So that was real early. And then we were very aggressive in our preparation, in that we had a very stringent quality control measures and infection control measures in place already. But we didn't allow anybody who did not have to have direct contact with the residents to come in the facility, and we didn't allow the residents to go out of the facility unless it was an extreme emergency. So just acting early, acting aggressively, and being, I would say, overly excessive as it related to the screening of our employees when they come to work, and just making sure that everybody had sufficient PPE stockpiled early before the shortages came. So those types of things helped us to accomplish where we are today.
Oh, very good. And the Maryland Baptist Aged Home is one of the oldest Black-owned nursing homes in Maryland. What are your thoughts on COVID-19 disproportionately impacting Black communities, and what actions can we take to help reduce this racial disparity?
Well, of course, we understanding that there was racial disparities, especially in healthcare and housing and education and employment, but mainly in healthcare and even with older Americans. And then we know that comorbidities affect people of color, uh, at a disproportionate rate. So we had to prepare ourselves for that. We had to understand that there was going to be a certain amount of self-reliance that we were going to have to engage in to make sure that our residents were cared for. And even though we followed the guidelines of the medical experts, we made sure that we were at least looking out for ourselves, because we weren't sure when help was going to come and if we were going to get help. And we knew that if COVID-19 got into our facility, it would be devastating. But in order for us to combat some of these disparities, there's going to have to be real conversations with people of power who will face the biases that they have and that we all have, and make sure that the services that people in communities of color are available and affordable. But the first thing we have to do is be willing to have real dialogue on the subject.
Absolutely. Thank you, Dr. DeWitt, for that. Dr. DeWitt, in your opinion, what are the most pressing issues older adults face today that must be resolved?
Well, again, we come back to the disparities in healthcare, affordability and access within certain communities. And then I think we have to work hard to keep our seniors healthy in the beginning. A lot of the programs that we see through our government are designed to help seniors after they have already encountered some problem, some health problem or a physical problem. But we need to, I think, invest more in making sure that our seniors stay healthy before they encounter the problems.
Absolutely. And one last question for you, Dr. DeWitt. What have you learned from your own family about healthy aging, and how do you practice healthy aging?
Well, I've been blessed to have both of my grandparents in my life. My grandmother on my father's side, she lived to be 98. My grandmother on my mother's side, she's still living. She's 93 and very healthy. And she never even had a doctor until the Affordable Care Act mandated it. So I've learned from them that you have to, one, stay very active, which I think is important for our seniors, to keep them active, keep their bodies active, keep their minds active, and two, then everything in moderation. As Grandma always said, it's not what you do, it's how you do it. And if you have things that you do that will abuse your body, you'll end up paying for it in the end. So just stay active and do everything in moderation. And I think my grandmother's one of the successes that they always taught me is to always keep God first, and that will also help you to have a long and healthy life.
Absolutely. Thank you, Dr. DeWitt. And thank you so much for your time and for your incredible work. And congratulations again on this much-deserved award. Great talking with you.
Thank you, and thank you so much for having me. God bless.